Let us now go to diagnosis through the tongue. The topic is coating part 2. In addition to inspecting the color of the tongue coating for diseases, the thickness, dryness, and presence of coating should also be taken into consideration. The changes in the thickness of tongue coating is indicative of the status of evil qi and vital qi in the body, as well as the severity of the disease. Thick layer of coating. Thickness is measured in comparison with your normal coating. When you cannot see the color of the tongue texture through the coating, it means the condition has become more severe or there is gastric retention. Observing the thickness of tongue coating is conducive to determining the prosperity or decline of vital qi or evil qi and the severity of the condition. Thick yellow dry coating indicates depletion of yin due to excessive heat. Thick and greasy white coating indicates cold dampness obstructions of the spleen and stomach. Thick powder-like white coating indicates retention of cold phlegm. Coating growing thick indicates the condition becomes more severe. Coating growing thin indicates the condition is improving. The tongue coating that is dry and lacks fluid is called dry coating. In severe cases, dry cracks may appear in the coating. Inflammation or chronic disease tend to have excessive heat accumulated in the body, leading to the depletion of fluid. The tongue cannot be nourished by fluid and turns dry as a result. Dry coating with a white tinge indicates poor water and fluid circulation in the body. Dry coating that is yellow in color indicates hyperactivity of stomach fire. Dry coating that is black in color indicates fluid depletion due to extreme heat. And a dry coating that is black in color with prickles indicates extreme heat exuberance, drying up body fluid. Putrid coating. This refers to a thick coating with big, rough, loose bumps, which is thick at the center and both sides of the tongue, like bean curd residues piling up on the tongue surface that are easy to scrape off. This mostly indicates a heat syndrome manifested as excess of endogenous heat. Dull and putrid coating with white or yellow color is often seen in food retention, turbid phlegm, and a dampness heat syndrome. Abscess-like coating, that is abscess putrid coating, indicates deterioration of an internal abscess. Membrane of white coating or erosion, that is moldy, putrid coating, is often seen in patients experiencing damp worm toxin, diarrhea, and infantile malnutrition. Greasy coating. This refers to tiny particles closely distributed and evenly forming into patches, attached closely to the tongue surface. It is thick at the center and thin on the sides and not easily scraped off. This sign indicates stagnation of dampness and turbidity, manifested as phlegm dampness and food retention. White, smooth, greasy coating indicates mostly phlegm dampness or deficiency of stomach yang. Thick and greasy yellow coating indicates phlegm heat, damp heat, and retention of food. Thick, greasy coating, not smooth, white as if thickly powdered, indicates external evil invasion accompanied by dampness. White, greasy coating, not dry, and self-reported sensation of oppression in chest indicates severe dampness due to deficiency of the spleen. White, thick, slimy coating and sweet taste in the mouth indicates damp heat of the spleen and stomach. Tips for caring for your tongue. For pale tongue, this is mostly the result of deficiency of qi and yang. To improve the tongue color, focus on restoring the deficiency and dispelling cold, invigorating qi to generate blood. Expose your back more often to the sun for its warmth. People with yang deficiency usually experience cold stagnation, so basking in the sun may help them replenish yang. It is recommended that people with a deficiency of qi in blood and a deficiency of yang should drink black tea, which warms the stomach, stimulates the spirit, warms yang, and invigorates qi. Massaging the Baihui point for 3 to 5 minutes every day will invigorate the yang in the governor vessel, thus toning qi and restoring the yang throughout the body. Gently scraping the skin on the back with gua sha therapy can also stimulate the yang of the back to replenish the yang throughout the body. For black tongue coating, with black tongue coating, therapies should focus on the aspects of diet, regulating work, a good rest schedule, and a TCM treatment to strengthen the body's resistance. In addition, avoid foods with heat properties such as spicy, pungent, and fried foods. Frequently consume vitamin-rich foods such as fruits and vegetables. Also drink water with ginseng slices and red dates, or Chinese dates, or jujube fruits. As ginseng can replenish the original qi, while red dates can promote blood circulation and tone the blood. If the black coating is thick and greasy, frequently massage the naguan point to help relieve blood stasis and smooth the flow of qi and blood. Exercise more with adequate amounts of time and intensity. It is best to just warm up until you perspire slightly. For thick white coating, when the coating is thick and white, it indicates cold dampness stagnation in the spleen and stomach. Therapeutic treatment focuses on warming the middle burner and toning the spleen. Frequently consume foods such as Chinese yams, mushrooms, chestnuts, and red dates, which tone the spleen, strengthen the stomach, nourish the blood, and tranquilize the mind. Eat less raw and cold foods such as ice cream and ice popsicles to prevent the cold from attacking the stomach. Do moxibustion at the guanyan point for 10 to 15 minutes every day to replenish yang and relieve symptoms of cold deficiencies in the spleen and stomach. Brush your teeth every day after you get up in the morning and before going to bed at night. Use salty water or mouthwash to rinse your mouth after each meal to keep your mouth clean. Thank you so much for your attention.
Let's continue talking about interviewing headaches of internal origin. In headaches of internal origin, it is very important to differentiate between those deriving from fullness and those deriving from emptiness. The most common headaches from fullness include liver yang rising, liver fire, phlegm, blood stasis, liver wind, stomach heat, and retention of food. The most common headaches from emptiness include blood deficiency, stomach and spleen deficiency, and kidney deficiency. The headache from liver yang rising manifests with a throbbing pain, usually unilateral, often moving from side to side and located behind the eye, on the temples or on the lateral side of the head along the gallbladder channel. It is often accompanied by nausea and vomiting, dizziness, blurred vision, flashing lights, and a wiry pulse. The headaches from liver fire, which is less common, is similar in character to that from liver yang rising, but it is accompanied by liver fire symptoms and signs such as intense thirst, bitter taste, red face, dark urine, and dry stools. Another very common type of headache is that from phlegm obstructing the clear orifices of the head. In this case, the headache is dull and the head feels as if it was wrapped in or full of cotton wool, with a pronounced feeling of heaviness, muzziness, and blurred vision. Other manifestations include a feeling of nausea, a feeling of oppression of the chest, a swollen tongue, and a slippery pulse. However, in my experience, one of the most common types of internal chronic headache is that deriving from a combination of liver yang rising and phlegm, with the phlegm being carried upwards by the ascending liver yang. The headache from blood stasis is characterized by an intense, fixed, boring pain, usually unilateral, and accompanied by a purple tongue and wiry pulse. In very chronic, long-standing cases of headache, the blood stasis type of pain often may be combined with other types. The chronic recurrence of a headache in the same part of the head may by itself cause local blood stasis. For example, if a patient suffers from a liver yang type of headache for many years occurring always on the right side, this may by itself cause a local stasis of blood in the head on that side, and thus the headache will manifest with symptoms of both liver yang rising and blood stasis. The headache from liver wind is characterized by a pulling pain, accompanied by severe dizziness and tremors. The headache from stomach heat is characterized by an intense frontal pain and is accompanied by epigastric pain, thirst, sour regurgitation, and a yellow tongue coating. The headache from retention of food is characterized by a diffuse and intense pain on the forehead and accompanied by nausea, vomiting, sour regurgitation, feeling of fullness of the epigastrium, a thick, sticky tongue coating, and a slippery pulse. The headache from blood deficiency, usually of the liver and or of the heart is characterized by a dull ache, usually on the top of the head, and is accompanied by dizziness, blurred vision, insomnia, palpitations, a pale tongue, and a choppy pulse. The headache from stomach and spleen Qi deficiency is characterized by a dull frontal ache and is accompanied by tiredness, lassitude, weak limbs, loose stools, poor appetite, pale tongue, and weak pulse. The headache from kidney deficiency, which could be yin or yang deficiency, is characterized by a dull headache all over the head, accompanied by a feeling of emptiness of the head, dizziness, and tinnitus. Thank you for your attention.
Acupuncture analgesia, peripheral mechanism. Sensory fibers. One of the first human studies to scientifically investigate the effects of acupuncture was conducted in 1973 and tested the analgesic effects of acupuncture against morphine. Two randomly divided groups of volunteers received either acupuncture at the acupoints for Li4 and stomach 36 or morphine intramuscularly. Although both groups showed an increase of 80 to 90% in their pain thresholds, researchers found that local anesthetic injection of 2% procaine at Li4 demolished any acupuncture effect or local sensation. Another study used direct stimulation of peripheral nerve sensory fibers and acupuncture needling. It showed that both raised the pain thresholds of the subjects in a similar manner. This report not only supported the finding that acupuncture raises the pain threshold, but also revealed evidence that acupoints may be related to peripheral nerve sensory fibers. Deep tissue nerve fibers. Clinical and observation studies of the similarities of acupuncture to the peripheral nervous system led to a topographic mapping of acupoints to their afferent nerve fibers. Zhao et al. Mapped 12 meridians, including Ren meridian, with its 324 acupoints, and saw that 323 had rich innervations. It was proposed that the effectiveness of acupuncture lies within deep tissue innervations and not superficial skin afferent fibers. Volunteers in a study by Chang et al. Experienced increased pain threshold with needling at acupoint Li4. Procaine administered to the deep branches of the ulnar nerve and median nerve, innervating Li4, eliminated acupuncture-induced analgesia. However, procaine to the cutaneous branches of the radial nerve innervating Li4 at the skin did not affect the analgesia. This study suggested that deep tissue innervation and not superficial afferents at the skin level are involved in acupuncture analgesia. Muscle tissue. Other studies revealing deep tissue mechanisms of acupuncture were derived from needling technique and achieving the Da Qi sensation. Because of the twisting and pulling of the needle in the muscle, one proposed mechanism of acupuncture's analgesic effect focused on the afferent receptors in muscle and other deep tissues. This theory stemmed from small clinical and observational studies. 11 patients had stimulation of ST36 and subsequently experienced Da Qi sensation and activity on electromyography. However, both were abolished after lumbar epidural, leading researchers to conclude that acupoints had afferent muscle receptor innervation through spinal cord pathways. Connective tissue. Another theory to explain Da Qi lies within the connective tissue itself. In acupuncture, the sensation of Da Qi is described as a fish taking the bait, and this may be a coupling action of the needle with connective tissues during the winding motion of insertion. Zhang et al. Found that stimulation of acupoint ST36 generated analgesia and degranulation of mast cells. Pain relief was diminished with destruction of mast cells with disodium chromoglycate at the acupoint. Yu et al. Found similar results with destruction of the SC36 collagen fibers with type 1 collagenase. This study suggests that mast cells in connective tissues may play a role in acupuncture effectiveness. Thank you for listening. Differential diagnosis of eye disease. Let's start with Western differentiation for eye disease. So we have macular degeneration. This is loss of central visual acuity preceded by drusen, which are small yellow deposits that form under the macula. So we have two types. We have atrophic and exudative. Atrophic macular degeneration, the bilateral vision loss is slow and painless. There is mild to moderate reduction of vision, rarely blindness. For exudative type of macular degeneration, vision loss follows rapidly from visual distortion in one eye. Peripheral vision and color vision generally unaffected, but the patient may become legally blind in affected eye. Optic neuritis. The symptoms are usually unilateral with eye pain and partial or complete vision loss over 1 or 2 days. Mild eye pain, vision normally returns in 2 to 3 months, but symptoms may recur. Primary open-angle glaucoma. Asymptomatic initially, some clumsiness or unusual visual effects. Detached retina, painless, dark, irregular floaters, flashing lights, blurred vision. Later symptoms, a curtain or veil in the field of vision. Uveitis, there is blurred vision and floaters in both eyes. Post-vitreous detachment, flashes of light, sudden rapid increase in floaters, a ring of floaters or hairs at temporal side of central vision, slight heaviness in eye. Cataracts, cloudy or blurry vision, sensitivity to light, halo around lights, difficulty reading, faded colors, poor night vision, double or multiple vision often clears as cataract grows, frequent changes in prescription for eyeglasses. Chinese differentiation for eye disease, diagnostic questioning according to organ interrelationships, liver kidney, Shan cycle, lung liver kidney spleen, Ko cycle. Symptomatology, red eye, sudden onset, acute attack, hot, dry, prickly eyes. Eyes may water, aversion to bright light. This is invasion of wind heat. Red, painful eyes that feel hot, may be dry, watering, hot tears, sensitive to wind, feeling of pressure from inside the eyes related to stress or emotions, hyperactive liver yang or liver fire. Dry, gritty eyes, blurred vision, lack of clarity, floaters in the eyes, photophobia, liver blood deficiency. Red, sore, dry eyes, long-term continuous symptoms, worse in the afternoon and night, kidney, liver yin deficiency. Blurring and progressive loss of vision, maybe pain or tenderness in the eye, halo effect around lights, developing blindness, macular degeneration. Asymptomatic glaucoma. Now let's go to Zhangfu patterns. All patterns, this would be kidney liver yin deficiency. Non-specific eye disease, stagnation of liver qi turning to heat, heat in the liver channel, wind heat invading the lung, hyperactive liver yang, liver fire blazing, liver blood deficiency. For optic neuritis, we have spleen qi deficiency or liver blood deficiency, hyperactive liver yang, liver kidney yin deficiency underlying, liver wind with phlegm fire, localized blood stasis. Macular degeneration, spleen kidney yang deficiency, qi and blood deficiency with qi stagnation and blood stasis. Thank you for your attention. Mamaya na.
Let's continue our discussion about relationships among the Zhangfu viscera, today the heart and the kidney. The heart governs fire and is a yang organ. The kidney governs water and is a yin organ. The relationship between the heart and the kidney is therefore one of the harmony between fire and water. The heart is in a higher position and the kidney lower. In normal conditions, heart yang descends to the kidney, where together with kidney yang, it warms kidney yin so that kidney water does not become overproductive. Kidney yin ascends to the heart, where together with heart yin, it moistens or moderates heart yang, so that heart yang does not become excessive. This reciprocation interaction of yin and yang ensures that the function of the heart and the kidney are harmonious. This is known as the harmony between the heart and the kidney, and the mutual support of water and fire. Disruption of this relationship can lead to disorder between the heart and the kidney, manifesting as agitation, insomnia, dreams, disturbed sleep, and nocturnal emission in men or sexual dreams in women. If heart yang is deficient, heart fire cannot descend to assist kidney yang. Instead of flowing normally, kidney water can then rise and attack the heart, leading to water qi and salting the heart. The symptoms are palpitation of the heart, edema, and dyspnea. In this illustration of the relationship between the heart and the kidney, the heart pertains to fire while the kidney pertains to water. As fire descends to warm water fluids, the water ascends to nourish the fire. So there must always be a dynamic balance between fire and water, the heart and the kidney. Thank you for your attention.
Let's discuss urinary bladder deficiency code as we continue with diagnosis according to Zhang organ patterns. If there is kidney yang deficiency, the kidneys may not be able to carry out their activities in relation to fluid physiology and the storage and expulsion of urine. Urinary bladder deficiency code is therefore kidney yang deficiency with signs that there is bladder functioning. Now let's look into its etiology. Kidney yang can be weakened by disease as well as food, drinks, and medicine that have a cold dynamic or temperature. Congenital weakness, old age, climatic cold, hard physical work, lifting heavy objects, standing for long periods of time, and too much sex can weaken kidney yang. Symptoms and signs: frequent or urgent reurination, copious amounts of pale, clear urine, nocturia or enuresis, incontinence, aversion to cold, cold limbs, shiny white facial color, pale, swollen, wet tongue with white coating, and a deep and weak pulse. The key symptoms here are frequent urination, aversion to cold, pale, swollen tongue. Treatment principle: warm kidney yang, assuage the urinary bladder. The acupuncture points you can choose from kidney 3, kidney 7, REN 3, REN 4, REN 6, bladder 23, bladder 28, and DO 4. For the needling technique, we tonify and moxa is also recommended. For a further explanation on the choice of points, kidney 3, kidney 7, REN 6, bladder 23, and DO 4 tonify kidney yang. REN 3 and bladder 28 drain dampness from the urinary bladder. The patient should consume a diet that is warm in both its temperature and its energetic dynamic. They should completely avoid foods and beverages that have a cold dynamic and that are cold in their temperature, especially in winter. In practice, this means avoiding fruit unless it is boiled or baked, salad, raw vegetables, and cold drinks. They should try to use more warming cooking methods when preparing foods such as oven-baked and grilled dishes, which are more warming than steamed and cooked dishes. Hot spices such as chili are not necessarily salutary because they will cause the person to sweat and thereby lose heat. Tonifying a deficiency condition is something that takes time and cannot be forced. The use of spices in general is helpful though, as they can activate yang. Spices that warm and tonify kidney yang are cinnamon, cloves, fennel, basil, sage, fenugreek, horseradish, rosemary, and black pepper. Foods that specifically tonify kidney yang are oysters, smoked fish, salmon, tuna, lobster, trout, mussels, shrimp, lamb, venison, duck, roast pork, kidney, chestnut, walnuts, pistachio, black sesame seeds, quinoa, oats, buckwheat, millet, aduki beans, black beans, deep boiled lentils, raspberry, and cherry. Green tea is cooling, so black tea will be better. Otherwise, ginger tea, fennel tea, yogi tea, and jasmine tea will all be good. A person who is kidney yang deficient must ensure that they get enough exercise. Light exercise is beneficial when there is yang deficiency because it will activate yang and qi. They must, however, be careful that they do not train so intensely that they become fatigued or tired, because this will further drain their yang. It is a good idea to start the day with physical activities that can activate and circulate qi. Keeping warm is important, especially in the lumbar region and the area below the navel. Wearing a belly warmer or a woolen stomach scarf around the midriff and lumbar can be recommended. Protecting this area from drafts should be a priority. A ginger foot bath is also beneficial, as is drinking ginger tea. Patients who are kidney yang deficient should avoid activities that weaken the kidneys and yang in general. Besides the above advice, men should limit how much sex they have, including masturbation, as kidney yang is expended upon ejaculation. Lifting heavy objects and standing weakens kidney yang and should be avoided as much as possible. Urinary bladder deficiency code can be caused by the following patterns of imbalance: kidney yang deficiency, spleen yang deficiency, spleen qi deficiency, cold, and damp. In turn, this can result to urinary bladder damp cold, urinary bladder damp heat, kidney yang deficiency, spleen yang deficiency, and damp. To summarize, bladder deficient and cold has its etiology in excessive sexual activity, exposure to cold weather conditions, or living in cold and damp places. The underlying or accompanying pathology are kidney qi not firm and kidney yang deficiency. The signs and symptoms: frequent abundant pale urination, dribbling after urination, incontinence, enuresis, lower backache, dizziness, nocturia, lower abdominal pain, and weak stream. The pulse will be deep and weak, the tongue pale and wet. Treatment principle: warm and supplement kidney yang. For the acupuncture treatment, bladder 23 to supplement kidney yang, bladder 28 to supplement the bladder, spleen 6 to supplement the spleen, REN 3 to supplement the bladder, DO 4 to supplement kidney and bladder, REN 4 to boost qi and supplement yang, and DO 20 to raise yang. We needle with supplementation and add moxa. For severe deficiency cold, we can add REN 6 and REN 4. For kidney yang deficiency, we can add DO 4 and kidney 3. Thank you for your attention.
Endogenous pathogenic evils. This time we discuss endogenous fire. Endogenous fire is generated when yang is overabundant or yin is deficient and yang hyperactive, or qi and blood are chronically stagnant, or external pathogenic evils accumulate in the body and transform into fire. Then we have the main types. The first is overabundant yang transforming into fire. In normal conditions, the body's yang qi acts to nourish vitality, warm the viscera and tissues, and keep the sinews supple. When it is overabundant, however, it stimulates overactivity of the metabolic processes and markedly increases the consumption of nutritive substances. In Chinese medicine, this is a situation of excess of qi is fire. Second, accumulated evils transforming into fire. This category includes two types of pathological processes. In the course of externally caused diseases, each of the external pathogenic evils is capable, under certain conditions, of accumulating in the body and transforming into heat or fire. This is so even within evils, such as cold or dampness. This is known as the 5 qi transforming into fire. The other type includes a miscellaneous group of conditions: food retention, parasitic infestation, and certain pathological products of metabolism, such as static blood, phlegm, and rheum, all can transform into fire. Third, passions transforming into fire. Also known as the fire of the 5 passions, This generally refers to situations of mental or emotional shock affecting the equilibrium of the body's yin-yang, qi blood, and the viscera. Loss of this equilibrium causes bottling up of qi. Prolonged bottling up of qi leads to heat in a person with a yang constitution, and from that, fire can arise. For example, mental depression often causes stagnation of liver qi, and the trapped qi can transform into fire. This is liver fire. Next, we have yin deficiency generating heat. Deficiency of essence and blood causes damage to yin fluids. Yin significantly deficiency in turn permits yang hyperactivity, hence deficiency heat and deficiency fire. Clinically, there is a difference between internal heat in yin deficiency and blazing fire in yin deficiency. In general, symptoms of the internal heat in yin deficiency are systemic, such as hotness in the 5 centers, rampant fever, night sweat, insomnia, excessive dreaming, and a red tongue with little coating. Fire blazing in yin deficiency, on the other hand, tends to be expressed in a specific localized area of the body. For example, toothache, sore throat, inflamed eyes, tinnitus, or dry mouth and lips. Thank you for your attention.
Let us now go to pathology of qi and emotional problems. The topic is derangement of qi. The first effect of emotional stress is to affect the circulation of qi. Qi circulates in the qi mechanism in the correct direction in each given pathway. In each part of the body, qi ascends or descends and enters or exits in the correct direction as appropriate. The correct ascending and descending and entering, exiting of qi in the qi mechanism ensures the smooth flow of qi. Emotional stress upsets the ascending and descending and entering and exiting of qi, and each emotion affects the circulation of qi in a different way, as anger makes qi rise, joy slows qi down, sadness dissolves qi, worry knots the qi, pensiveness knots qi, fear makes qi descend, and shock scatters qi. Here we can see the effect of emotions on qi mechanism. The solid arrows indicate the physiological movement of qi, while the dotted lines indicate the pathological movement of qi induced by emotional stress. The simple questions in chapter 39 says, anger makes qi rise, joy slows down qi, sadness dissolves qi, fear makes qi descend, shock scatters qi, pensiveness knots qi. However, the above are not the only terms used in the Yellow Emperor's Classic to describe the effect of the emotions. Dr. Chen Yan, in a treatise on the 3 categories of causes of diseases, says, joy scatters, anger arouses, worry makes qi unsmooth, pensiveness knots, sadness makes qi tight, fear sinks, and shock moves. The effect of each emotion on qi should not be interpreted too restrictively. In certain cases, emotional pressure may have a different effect on qi. For example, fear is said to make qi descend and it may cause enuresis, incontinence of urine, or diarrhea, because the kidneys control the 2 lower orifices, like the urethra and anus. This is certainly true in cases of extreme and sudden fear, which may cause incontinence of urine or diarrhea, or in the case of children when anxiety about a certain family situation may cause enuresis. However, the effect of fear on qi depends also on the state of the heart. If the heart is strong, it will cause qi to descend, but if the heart is weak, it will cause qi to rise in the form of empty heat. This is more common in old people and in women. In such cases, fear and anxiety may weaken kidney yin and give rise to empty heat of the heart with such symptoms as palpitations, insomnia, night sweating, a dry mouth, red face, and a rapid pulse. Thank you so much for your attention.